Hi everyone! In this short concept video, we will go over the process of what the cardiac cycle is. We will start with atrial and ventricular, both being at what's called diastole. Being in diastole, remember that the heart or cardiac muscle is in relaxed mode. It is not contracting, it is in its relaxed mode. So I will draw the atria, okay, the right atria, like that, right atrium. And we can't forget of the pulmonary. We can't forget about the pulmonary trunk. And we also have then the left atrium and the left ventricle, which then goes up into the aorta. So again, I will label these as this being the pulmonary trunk. This is the right atrium. This is the right ventricle. This is the left atrium. This is the right ventricle. And lastly, this being in the aorta. And we will just need to know these particular parts for this first section. Now, we will also have this valve right here and this valve right here, both being collectively called the AV valve, or specifically this one on the right side of the heart. This one is called the tricuspid valve. This one right here on the right side of the heart, between the left side of the heart, between the left atrium and the left ventricle, is then the bicuspid valve, or also called the mitral valve. So in the first part of the cardiac cycle, you have the AV valves, or the tricuspid and the bicuspid valve, open at this point because there is what's called passive filling, where both ventricles are being filled to 70%, approximately 70% fill. And this is due to what's called passive filling, where blood is just moving in from the atria into the ventricles at the same time, and they're just draining into the ventricle without the atria doing any type of contraction. So there's blood inside the atria that is being drained into the heart. And remember, you have about 70% of the ventricles being filled just by passive filling alone. And then the next step is where atria undergoes systole, or atrial systole. At this point, ventricles are still under diastole and have not switched over to systole just yet. So when the atria contracts, I'll kind of show it being a little bit smaller. And there's again, the right ventricle, the aorta, left atrium, and left ventricle. So at this point, the atria, I'll put arrows like this to show that they are being contracted. Okay, so the atria contracts, it pushes all of that blood that's still remaining in the atria to fill both ventricles completely. So now, technically speaking, we have 100% filled hearts or ventricles for both left and right. Now, this 100% is also what we refer to as EDV, end diastolic volume. It is when the ventricles are filled with all the possible blood that the atria can push into the ventricles. And again, at this point, if we go back to here, the aortic valve and the pulmonary valve are currently closed, and it's still the case here. The AV valve are open still. So I'll write that here. AV valve open, and your pulmonary, or you can collectively call it semilunar, valves are closed at this moment. Okay, here same thing. AV valve are open, semilunar are closed. Now, after atrial systole is complete, pushing all of the blood from the atria into the ventricles, now you have getting ready for what's called then atria will then undergo diastole, because it's done its job and now it's just relaxing for the rest of the cardiac cycle. Your ventricles, however, now it is their turn for undergoing ventricular systole. Okay, so remember systole for contract. Or one of my students says S for squeezing blood. Diastole kind of sounds like dilate, which means relax. And so when atria is back into their relaxed phase, and then you have your right ventricles starting to push inwards. So again, I'm going to put arrows there, and I'll put bigger arrows this time to show that ventricles contract with a much stronger force than the atria. Okay, so that shows contract. The ventricles contract this time, and the atria remains relaxed, and you have your aorta there. Now, when ventricles contract, AV valve right here, I'm going to put an X there to show that AV valve, okay, are closed, whereas semilunar valves are open. Of course, ventricles have to build up enough force in order to push open the semilunar valve. So I'm going to show the aortic valve doing that and the pulmonary valve doing that, showing that now it is open. It has to, the ventricles have to generate enough force in order to push open these semilunar valves. So of course, blood will then move upwards, okay, either into what's called the pulmonary trunk, moving on to the pulmonary artery, into the pulmonary circuit in a sense. Just to cut it short, I will do another video on blood circulation, but this is just focusing on the blood flow during cardiac cycle. And for those that goes into the aorta, we'll then move on to the systemic circuits. Okay, so blood from the right ventricles will be pushed into the pulmonary trunk, into the pulmonary circuits. There will be some leftover blood in there. For the left ventricle, they will push blood into the aorta, onto the systemic circuits. So that's why there's this arrow here showing blood moving upwards. And again, there will be some blood left over. Now for the blood that's left over right there, we call that ESV. ESV meaning end systolic volume. This is when the ventricles are done doing systole phase, and that's the blood left over. That's why it's called end systolic volume. Blood left over in the ventricles. Now, what about the blood that has moved on to either the systemic circuits or to the pulmonary circuits? We call that volume SV. SV, or stroke volume. So again, ventricles contract, undergo systole phase, pushing blood into the pulmonary circuits via the pulmonary trunk, or pushing blood to the systemic circuit via the aorta. The amount of blood that's pushed into the two circuits is what we call SV, stroke volume. Blood left over after ventricles have contracted is what we call end systolic volume, what's left over here. So now what's going to happen after that is we will go back to atrial diastole still, because it has already done its job here, and ventricles now are also back at ventricular diastole. Okay, ventricular diastole. So in this case, you have your relaxed atria, and then you have your pulmonary trunk and the right ventricle, left atria, left ventricle that goes up into the aorta. All the valves at this point should be closed, whether it be your AV valve, tricuspid valve, bicuspid valve, or the semilunar valve, which is the aortic valve there, and the pulmonary valve. All valves are now closed until the ventricles have completely relaxed, because it takes a while. It's a big muscle in the heart. So it can push to contract. And then, of course, it have to wait to become relaxed until it is completely relaxed. Again, you still have little blood left over from previous stage. And it will eventually, when the ventricles have completely relaxed, you will go back to that phase that we started with at the beginning. Because once ventricles are completely relaxed, it will open the AV valves again, and passive filling will occur again to 70% line way back in the beginning. Okay, so make sure you're aware of whether atria or ventricle are undergoing diastole or systole, relax phase or contraction phase, the volumes, that is through passive filling, EDV, ESV, and SV, and take a note at when these valves are open at each of these stages. I hope this helps you.